name is Rosyln. Before you guys start writing, that is not the title of my presentation. So when I do start, I'll let you know. So like I said, I've been here since 2006. And I've been placed in like various places, which I think Asian is very good for. So for example, I did objective structured clinical exam my first year, which was more like a social experiment with residents that came straight from medical school. Then I worked in Milieunm in the food nutrition services, learning more about nutrition and the diets for people for the patients that have cancer there. And I also worked with my current mentor, which is Dr. Milieunm, for the last 3 years. I worked on sinusitis, on bed bugs, and my current work is HIV in the elderly, which is the presentation. My other partners were Kadari Ransom and Angie Chan. They were with us last year, but they're not here this year. And mentors Dr. Milieunm, co-mentor Shirley Golden. So, what is HIV? HIV is the human immunodeficiency virus and attacks and breaks down the immune system. It invades the white blood cells to replicate itself and leaves the body more susceptible to illnesses. And then eventually it may grow and mature to AIDS, acquired immunodeficiency syndrome. And from this we got this data from the Centers for Disease Control and Prevention. And it's basically a chart saying the estimated numbers of people that got HIV in different age groups. But for our experiment, we want to mainly focus on the elderly because there's a misconception that the elderly are not sexually active, but they still are. And so for transmission of infection, it's likely for you to contract HIV from, of course, unprotected sex, sharing needles, and the other risk factors which have now been mainly eliminated would be transmission during infection mother to fetus. Now, for years now, they've made sure that whenever a lady is pregnant, they test them and screen them for all different illnesses to make sure that they don't have any that can be passed on to their fetus. And then another one would be infection from blood products. But now they make sure when they do get the blood products, they test them, check to see if everything's all right. Symptoms would be during the incubation period. Some people don't really see much at all occurring. It could be that you could have the first 6 months and not see any signs. But as time progresses, the symptoms may include fever, rashes, swollen lymph nodes, fatigue, but they're not limited to these symptoms. And they can also affect the brain, the heart, the kidney, and genital organs. And different ways that people can be diagnosed with or for screening would be done with, would be the ELISA test, which would be the enzyme immunosorbent assay. The rapid screen testing, which they usually prick you and it can tell you after a few minutes, and the Western blot, and which further confirms if you're positive for testing. After the HIV diagnosis, they would have different routine testing, some as CD4 count, check the bone marrow and the brain and so forth. So now our project is HIV diagnosis being missed in elderly patients. Background history on that, about between 11 and 15% of the U.S. AIDS cases occur in people over the age of 50. Although the perception exists that the elderly are not at great risk for HIV disease, data from the National AIDS Behavior Survey indicates that 10% of persons over 50 years of age have at minimum one risk factor for infection. And of course, the older you get, the worse you can really handle certain diseases. Of course, with HIV, you carry a higher mortality rate. And also due to the fact that when you get older, some people can carry on more poor nutrition and the immune system might be weaker. And you're less likely to practice safe sex. And of course, as some of the patients that we spoke to that were over the age of 50, some of them thought that, oh, I'm over 50, the people I'm with or whatever, I'm not going to get any HIV or contract any disease, but you're still putting yourself at risk for not protecting yourself. And as age increases, so does the incidence of mortality. So our HIV research project is done at Beth Israel Medical Center, and all patients that come in there, no matter what age they are always screened for HIV, so they don't discriminate on if you're young, or as in some places, they only test people at certain age brackets. Over there, even if you're 8 years old, they're still screening you for HIV. And then we give them questionnaires prior to the clinic visits. They screen for drug abuse, alcohol use, tobacco consumption, and unsafe sex practices. And the results that we received were mainly that the elderly patients admitted were not aware that they were capable of contracting HIV, like I said before. And a number of the elderly patients said that they've been smoking for a very long time, but expressed interest in quitting smoking. So we also aided them in getting help with that, because I guess when it comes to some of them with the alcohol drinking, they were conscious of the decisions they were making. They were making the wrong decisions when it came, especially up to the time of sexual contact. And our research intervention, like I said, we direct them to addiction centers, and patients engaged in unsafe sexual behaviors were educated about sex practices. So we educated them about different types of contraceptives. So some of them, I guess, they're pretty much old school and don't know about the different ways that everyone can be protected. And different treatments do exist, so we tell them if they did have the HIV, what different treatments they had, such as antiretroviral drugs that would block certain activities that occurs in the body from the enzymes of HIV, such as reverse transcriptase inhibitors, protease inhibitors, fusion inhibitors, integrase inhibitors. Basically, it works in their name. So basically, these drugs inhibit reverse transcriptase or inhibit the protease, inhibit the fusion, inhibit integrase. So. And what we learned was that that the healthcare providers should remember that elderly patients are also at risk for HIV and shouldn't discriminate on the age just because we think that they might not be sexually active. Research on HIV and AIDS in the elderly should be given more attention, and the impact of HIV AIDS in the elderly population. Healthcare system needs to be studied more extensively. And what we as health providers can do for our patients is diagnose and manage the elderly patients with HIV and make them feel comfortable and not feel embarrassed. Because a lot of them, even who were proposing questions on their sexual practices, they were just very nervous and shy to say such a thing because they felt that people say when you get older they're not active anymore. And like I said, remove the misconceptions that the elderly cannot contract HIV since they are believed to not be sexually active. And we counsel them, like I said, we tell them there's abstinence, monogamous relationships, protected sex, use of sterile needles, and just basically awareness and education. And those are my partners, and those are some of the tools that we use. So we stick condoms, so different types of condoms, female, male, genital dams, needles, not sharing them, and stuff like that. And these are our references, and we would like to acknowledge Dr. Sat Bhattacharya, HCS and staff, Dr. Mary Wong, and my co-mentor, Shirley Goldman. Any questions? No questions? Yeah?
Going into this, do you have a hypothesis as to what your results will be considering how many people you serve it?
It's an ongoing. We didn't really have a hypothesis, I guess, because our doctor just threw that question to us, do you think that that the elderly are being discriminated when it comes to HIV and different sexually transmitted diseases? And we're like, we don't think so. We didn't know anything about it, so she just told us, all right, we're going to interview some of the patients that come in. And I didn't know that a lot of the patients that she does have were HIV, or they didn't know that they had it, or they found out when they got older. They didn't really contract it when they were younger, or anything like that. And then we just basically wanted to see if we should continue to study more extensively on the idea. And from this, now we realize, okay, now we should do a little extra study to make it more important. Everyone else to see that it is an important topic to us. So, yeah.
How are you receptive?